Hello, and welcome to I Wish Someone Would Have Told Me. I'm Ava, and today we're talking about something that can be frightening when it happens for the first time: heart palpitations. Have you ever been sitting quietly and suddenly felt your heart flutter? Maybe it felt like your heart skipped a beat, or perhaps it started racing for no obvious reason. For many women, that moment can be scary. Your first thought might be, is something wrong with my heart? What I wish someone had told me is that heart palpitations can sometimes occur during perimenopause and menopause, and many women are surprised to learn there's a possible connection. That doesn't mean you should ignore them, but understanding what's happening can help reduce some of the fear. So, what are heart palpitations? Heart palpitations are the sensation of being aware of your heartbeat. Some women describe them as fluttering, racing, pounding, skipping beats, a sudden thump in the chest. Sometimes they last only a few seconds. Sometimes they may happen more frequently. And because they're unexpected, they can cause anxiety, which may make them feel even more intense. Now, why might heart palpitations happen? During menopause, researchers are still learning about the connection, but hormonal changes may affect the cardiovascular system and the way some women perceive their heartbeat. Palpitations may also be influenced by stress, anxiety, poor sleep, caffeine, dehydration, certain medications. This is one reason it's important to look at the bigger picture of your overall health. Many women notice that palpitations happen more often during periods of stress or after a poor night's sleep. Something you can try. If you've been experiencing occasional palpitations, here are a few things that may help. First, pay attention to triggers. Keep a simple notebook or use your phone. Notice what time they occur, what you ate or drank, how much sleep you got, whether you were feeling stressed. Patterns like these can sometimes appear or occur. Second, stay hydrated. Even mild dehydration can affect how you feel. Try drinking water consistently throughout the day. Third, limit excess caffeine. For some women, too much coffee, energy drinks, or highly caffeinated beverages may make palpitations more noticeable. You don't necessarily have to eliminate caffeine completely. Just pay attention to how your body responds. Fourth, practice slow breathing. When we become anxious, our heart rate may increase. Try this simple breathing exercise. Breathe in slowly through your nose for 4 counts. Hold for 4 counts. Then exhale slowly for 6 counts. Repeat this slow breathing process a few times. Many women find this helps them feel calmer. Fifth, prioritize sleep. Poor sleep can affect almost every system in the body. Getting consistent, quality sleep may help support overall well-being. Did you know that many women report heart palpitations during perimenopause and menopause, yet it's one of the symptoms that's discussed far less often than hot flashes or mood changes? That's one reason so many women are caught off guard when it happens. Myth versus fact. Myth: if I'm having heart palpitations, it automatically means something is seriously wrong. Fact: heart palpitations can have many causes, including stress, caffeine, hormonal changes, and lack of sleep. However, new, severe, persistent, or concerning symptoms should always be discussed with a healthcare professional. When should you contact your doctor? Listen, this is very important. If you experience chest pain, severe shortness of breath, fainting, dizziness, palpitations that are persistent or worsening, please seek medical attention immediately. It's always better to go to the doctor to ask questions and get reassurance than to ignore symptoms that concern you. What I wish someone had told me is that fear often comes from not understanding what's happening. The first time something unusual happens in our bodies, our minds naturally jump to worst-case scenarios. But information can be powerful. Learning about possible causes doesn't replace medical advice. What it does is help us ask better questions and advocate for ourselves with confidence. Before you go, here's today's gentle reminder. Just because a symptom feels frightening doesn't mean you have to face it alone. Ask questions, seek answers, talk with your healthcare provider. And remember that understanding what's happening is often the first step toward feeling more confident and in control. Ladies, have you ever experienced heart palpitations during perimenopause or menopause? I'd love to hear about your experience in the comments. And if this video helped you better understand what's happening, please subscribe for more conversations about women's health, aging, and the things many of us wish someone had told us sooner. Also, if there is a particular subject that you would like us to make a video about regarding perimenopause, menopause, or issues about getting older, let us know in the comments section below. Until next time, take care of yourself and be kind to yourself.